When people have had the kind of acclaim that Paul earned and have had the kind of impact in the ways that he did, it's always interesting to watch how they navigate in their alma mater. And certainly Duke is absolutely thrilled about its connection to Paul. And Paul was thrilled about Duke. Paul was like a, dyed-in-the-wool Dookie. He loved this place.
He was a man whose work had huge impact. And that's also what we're trying to do. We're trying to have impacts in the real world.
I think the way that Dr. Farmer did global health is more relevant now than ever in how he espoused it. It was such a tenacious way of doing global health, but also such a human way, doing it alongside instead of for.
That is Paul Farmer. That certainly was always at the core of who he was. And that began here at Duke.
One of Paul's and my favorite sayings over our 40 years of friendship was 78 was great. Because it was in 1978 when we both kind of came down to Duke and met each other on the first day as we were moving in.
Paul Farmer was a Duke undergrad. He was a scholarship student.
I think we all meet people in our lives that have a certain magnetism, charisma, different words can be used, but he was one of those people. Paul had a wide group of friends. Some of those friends were very much staying up to midnight with flashcards studying for a Chem 11 final. And others were very much focused on looking at some of the issues around migrant workers near Duke.
He very quickly started his global health work as an undergrad at Duke. That certainly was part of why he was drawn to Haiti, which became the place that he really was known most for.
My sweet Jenny, I am not at peace mentally. This world is in a sorry state. In places where government officials seem interested only in their own self-advancement, perhaps grassroots community-level organization will be more effective.
I think a lot of people came to us and said, oh, how did you do this work? Oh my God, how did you make these decisions? He says, well, I've taken a Hippocratic oath to treat the people that are the sickest. It doesn't take really a PhD to figure out where the sickest people in the world are. And I think that was almost that simple for him. And I think he had, from developing his theory of change and the way he looked at the world, 100% can be traced back to classes he took at Duke. And I think that really formed his thinking that you really couldn't isolate health. It had to be taken in a more holistic approach, and you had to understand the politics of the society and the environments in which you were working.
In 2006, when the Duke Global Health Institute was being created and being formed, it was a very important time for the field, and Paul was a part of that project, and he played an essential role in the establishment of the Duke Global Health Institute.
The clamoring from the undergraduate students at that time for us to do more in global health, to start a major, to have a minor, it reached a fever pitch, and a lot of it was driven by their aspirations to have the kinds of impacts that Paul had.
Christine and I both graduated in 2008, and we were the first cohort to graduate with the Global Health Certificate program.
I didn't know anything about Paul Farmer until I read the book, Mountains Beyond Mountains, and I really felt like that was formative and foundational to me as I then entered my global health career.
At the launch of the DGHI, when it happened during our sophomore year, he had come and he was a speaker.
Yes,
along with Anthony Fauci, Amartya Sen, all the rock stars of global health were there, and for us to be sophomores and just interacting with them was just glorious.
Yeah, life-changing.
I came to campus in the fall of 2011, took the Intro to Global Health class that DGHI offered, and I pretty much knew immediately that that was the field that I wanted to pursue professionally. I've always been really moved by Paul Farmer's path that he took and the approach that he took, and I think in some ways I wanted to follow along in his footsteps.
I'm so proud of those early days when you had all of these students who had so much pent-up interest in studying global health, and then they took the risk to study this thing, this strange major. I'll never forget those first couple of graduation ceremonies. Student after student was sort of walking down.
I teach the undergraduate Introduction to Global Health course, and Paul Farmer shows up in the first 5 minutes. That's not by accident, because the way that we approach teaching global health here at DGHI is really anchored in his emphasis on global health equity.
This is going to be a new clinic and hospital.
Day one of any class I teach, I'm going to talk about the human rights quote that Paul talks about. The idea that some lives matter less is the root of all that is wrong with the world. If students can get that, the why nots become, let's do it.
There's a direct relationship between the way Paul approached global health and the ways that we place students in the field, to the ways that we cultivate their humility, their ability to collaborate with community partners, as well as a sense of hope and hopefulness that we can make a difference.
Really, when I reflect on Dr. Farmer's work, I see a lot of what I do really reflecting most of the work that he did, especially with my research in Tanzania.
I tell the students at DGHI to shake the tables and shake it free a little bit. I think it helps you get out of how things have always been to making it a different world. And I think Paul did that.
Experiential learning, really the core of it is that students have to learn by doing, and they have to get out into the field and work with communities. We've sent students to over 40 countries. That was a very big part of Paul's approach to education, and it's at the core of our mission. And it really is a life-changing experience.
I think this opened an entirely new perspective for me. During my time in Kalangala, this district of 84 islands in Lake Victoria, and we had to take many, many boat rides to reach some of these patients in these faraway islands. We're just landing on just a patch of sand, and it was something that was different from any of my other pre-med experiences that I've had here.
The importance of Dr. Farmer's community-based approach is something that I realized when I actually went to Kenya and when I actually went to the community that I was working in. Once I was able to arrive at the place and know the people that I was trying to help, it became much more about a partnership as opposed to like a very scientific research project.
DGHI, I think it's essential that we do that work and that we prepare our learners to be out there. And that is not an inexpensive thing to do. It takes resources to get people out into the field and back, but we are very good at it.
As a member of DGHI's Board of Advisors, I really feel that Paul Farmer's influence early on set the foundation, the direction, the tenor of the Institute, and now to this day, I feel like we still, every board meeting, his name comes up. He really is an influential voice in discussions and deliberations about how Duke can best serve global health.
Dr. Paul Farmer's work is very relevant today and in the future still. We really need to hone in and make sure that individuals that are marginalized, individuals that are being denied access to care, do receive care.
In a world of rising inequality, it has never been more important to focus on health equity, and that Paul Farmer's vision matters now more than ever. And I am so proud of our faculty and the commitments they have to the learners and to ensuring that when they get out into the field, they're ready, they're well prepared, and they're poised to both learn a great deal and also give back to the communities. I think that's so important.
Paul retained a strong affinity to Duke. With his pride at Duke, his ability to sit on the Duke board. And Paul was always a long-term planner. So to know that the team is now focused on how to further expand the vision and the work that Paul did during his life is exactly the kind of work that I know Paul would be incredibly grateful for to the Duke community.